Good evening, everybody. My name is Susan Bouillon. I'm doing childhood sexual abuse and sexuality. What is childhood sexual abuse? Childhood sexual abuse can be defined by sexual acts that a child is engaged in where a child cannot comprehend um, or from which the child is developmentally unprepared and cannot give informed consent and or violates the law and social taboos of society. There are many effects that childhood sexual abuse can have. Some of the psychological effects that childhood sexual abuse can have are depression, post traumatic stress disorder, borderline personality disorder, and self destructive behaviors. Childhood sexual abuse has many implications when it relates to sexuality. The correlation between childhood sexual abuse and sexuality can be sexual satisfaction and functioning and or high-risk sexual behavior. Studies have shown that women that have experienced childhood sexual abuse experience less frequent orgasms, less responsiveness, and lower levels of sexual satisfaction. They also have higher rates of current and or past sexual dysfunction. Some of the high-risk behaviors that women that have experienced childhood sexual abuse may have are higher rates of sexual partners, early onset consensual sexual activity, teenage pregnancy, and unprotected intercourse. Childhood sexual abuse has also been linked to low rates of condom use, increased rates of abortion and anal sex, and inadequate safe sex decision making, and HIV prevention communication. These findings have huge implications for women's health, and they suggest that women who experience childhood sexual abuse may place themselves at greater risk for diseases and disorders, and are also associated with high risk sexual behaviors that can lead to sexually transmitted diseases. Women that experience childhood sexual abuse also experience negative feelings towards sexual arousal, such as fear, anger, and disgust, more so than non abused individuals. When looking at childhood sexual abuse and the implications that it has with regards to the five circles of sexuality, it deeply affects all five circles of sexuality. It has negative effects on sensuality, intimacy, sexualization, sexual identity, and reproductive and sexual health. Using a trauma informed approach with clients that have experienced childhood sexual abuse, it is imperative to avoid re traumatization during interviewing and or therapy sessions, and to assist the person in healing through trauma informed care and understanding why they feel the way they feel.